Your local station, WMBS. And time for Medicare A to Z with Aaron Zolbrod of the Health Insurance Store. And we are taking your questions at 724-438-4593. Also live streaming this program on our WMBS Facebook page. So if you have a question that you would like to ask through the comments section, we'll be happy to look at it then. And good afternoon, Aaron Zolbrod.
Hey, Bill. I got to get used to this live streaming stuff. I was just playing chiropractor on myself.
Well,
I got to remember we're on camera now.
Hey, you know, but it's important to be limber when we're doing this show. Right. So, you know, it's because you bend over backwards to help your clients.
There you go, Bill. We need to go on.
We're here all weekend. Try the veal. It's the best in the city. Aaron Zolbrod from the Health Insurance Store. Again, if you want to call in and ask him a question today, it's 724-438-4593. Or if you want to call him at the Health Insurance Store in Connellsville, 724-603-3403. Or the website, getyourbestplan.com. And we start off, and I know it seems like we start the show off this way every weekend, but rather every 2 weeks. But there might be somebody who's not aware of what the Health Insurance Store is and what you do, and also about your story as well. So we'll get a quick thumbnail here.
Yeah, so I am Aaron Zolbrod, and I'm the president and founder of the Health Insurance Store. And April 1st, it will be 13 years since we opened our doors in our Connellsville office. And as we talk about usually mostly every week is the name of the business implies what we do is that we're all things health insurance, Medicare, which we're here to talk about today from A to Z, employer-sponsored insurance if you own a business and you want to get your employees health insurance, or you already have them on a plan, you'd like to change your broker to us, we can do that. And lastly, we also do individual plans. We are back in the Obamacare business, ACA, Affordable Care Act, whatever you choose to call it. That started November 1st, so we can help you with that as well. And we are brokers, meaning we are appointed to provide plans from every competitive Medicare supplement, Advantage plan, Part D plan, virtually all of those companies on the competitive plans in the market, including the competitive group health insurance plans and also individual plans.
And we are going to cover Medicare supplements and Advantage plans and more over the course of the next couple of hours. But if you have a question about anything related to what the Health Insurance Store does, about your health insurance, maybe you've gotten an odd bill or something like that, give them a call here at 724-438-4593. And again, a reminder, just in case, again, somebody is just moved here from Mars or something, next year, the state of Pennsylvania is changing its Affordable Care Act coverage.
Well, they changed it. It's already changed, unfortunately. So we're using that. We're using that platform. And we were here last week. We were a couple weeks ago, we were pretty pleased to report that it seemed to be going off without a glitch. But we are having some glitches today as we
jinxed us.
Yes. So, again, we're going to get through it. If you call for an appointment and we move you to the later part of the month, don't be surprised, or early December, just because we need to wait for them to work the kinks out. Today we had somebody who qualified for a subsidy on their premiums, and we put them in, and lo and behold, it wasn't giving them their subsidy. They actually qualified for a pretty large subsidy, and we called the marketplace and asked them to take a look, and they couldn't explain. Pennsylvania marketplace, Penny, and they couldn't explain. And the scary part, the toughest thing about this Penny is their employees are brand new.
Right.
They are brand spanking new.
They were in training a week ago.
They were in training, and who knows what they were trained upon, because they didn't have any live people to be trained on, and they weren't sure what kind of calls they were going to get. So I did call last week, and it did not go well. So hopefully, again, we'll work those kinks out and be able to. The good news is with Penny, as far as Penny goes, is that they are extending it this year. So we have until I believe we have until January 31st to enroll people, which is good news. So they're giving us extra time, and thank goodness, because I'm not really sure if we're gonna it's really frustrating when you bring somebody in an appointment like Sadie had today, and she knows what it should look like. And when we go in to apply for them, it doesn't look like at all like what we would expect. And then we have to bring those people back in for a second time once they fix those glitches. So
A, be patient. B, call the health insurance store and get help. And try and navigate, at least the first time.
Well, I would feel terrible for somebody in this situation who went on there and tried to navigate it themselves, right? Because they didn't know. Oh, okay. They didn't know that they should have. We know that they should get a subsidy. So we know that. But if somebody would have gone on there today online and done it themselves and just enrolled, they could have paid $1,000 more a month for their health insurance than they should have.
Yeah. And plus, if you've been using the nationwide marketplace over the course of the last 3 years, and let's be honest, it has really gotten fairly user friendly.
Yes, it's been less glitchy. Yeah, I guess you could say.
Yeah, so if you're expecting the same experience going with Penny, you might be a little bit disappointed.
Yeah, again, it might take 2 or 3 years for them to work through all this stuff.
So give them a call at the health insurance store. They are in the Penny business. You can call them at 724-603-3403, or again, getYourBestPlan.com. Set up a time. And again, as far as the office, it is open. You are, of course, using CDC guidelines for COVID-19.
Yes.
So, or you can do it virtually. You can do it over the phone.
I really am enjoying the virtual appointments because people can actually see what's on my computer.
Oh.
If I want to do that in an appointment, I have to turn the screen around, and I can't see it when they're seeing it. What I like about the virtual appointments, you can literally see what I'm seeing on my computer. So you can watch me quote you in real time. You can watch me search for your medications in real time. You can actually see my face and I can see yours. So, if you don't want to do a face-to-face appointment, COVID is starting to get a little bit...
it's riled up again.
Yes, it's starting. So if you do want to do a Zoom appointment, they're really simple to do. It's me just sending you an email, you clicking on a link, and pretty much... you can get on and see me. So I'm very pleased with it, and I'm not I'm not the most technological person in the world, and if I can do it, most everybody can.
724-438-4593 if you want to talk to Aaron on Medicare A to Z, and we do have a call standing by. So Aaron, let's go to the phones and say hi. You're on Medicare A to Z. Who are we speaking with here?
It's Rutro here.
Rutro.
Yes, Rutro. Aaron and I have been playing phone tag for about a week, and I said, I know how I'm going to pin him down. I'll get him on the program.
I'm going to get that guy. You know where you can pin that guy down, huh?
I'll pin him down right on the program. Well, I had some friends, they're young, and they moved to Florida. And because of her income and everything here in Pennsylvania, she was eligible for the medical card. Well, they didn't check into the fact that Florida doesn't have a medical card unless you're 65 years of age.
So Florida might be one of the, Florida might still be one of those states where they didn't expand Medicaid. Florida is generally a blue state, I guess, isn't it? Or red state.
Yeah,
excuse me. They're a red state. So some of the I know when Corbett was a governor, when Obamacare passed, he did not expand Medicaid the first year, and it was really a tough situation for many people because they didn't make enough. They made too much money for medical assistance, and not enough to qualify to get a subsidy through Obamacare. So I'm wondering if that's the situation your people in Florida are in. It sounds like they are. So those people who are caught between 101% and 137% of the poverty level, or 138% of the poverty level, they're in no man's land. They can't get medical assistance, and they can't get a subsidy for Obamacare. So it stinks.
And then the advice that you gave, the woman's name down in Florida, I guess she's an insurance agent. She has her on a medical plan for less than $30 a month. And So she said, well, if you ever get to talk to Aaron, you just tell him thank you.
Okay, good. She did. So she was able to get them a plan. My friend.
Yeah. She's got a plan because she's, like I said, she's not 65.
Oh, but she is on Medicare, though. She is on Medicare, though?
No, she's not on
okay.
Medicare. She's 52 years old, but she's low income, and she makes less than, I think, $18,000 a year. But she was eligible for the medical card here through welfare.
Right.
But
in Florida,
they don't have that in Florida.
Right.
You have to be 65 years of age. So there's a words of wisdom to the wise. If you're going to move to Florida, make sure that you check it out first.
Yeah.
And so now she's going to be paying like $28.50 a month, and she's going to have the same coverage that she had with the medical card here, and pharmacy and all that type of stuff. But she'd have never known to do that if she hadn't known the rules in Florida. And what I can't understand is, Aaron, why don't we have a clearinghouse that groups all the 50 states and everybody has the same coverage?
Well, that would be called Medicare for All. So you could do that, but it would have to be under the guise of Medicare for All, because we have these things called networks, hospital networks, and so that's what complicates matters. So, I know there was always talk about, buying cross state lines and this and that and the other. Well, that was all smoke, because I can't buy, let's say I can't buy Kaiser Permanente's coverage and use UPMC facilities here. They're not in network. So that doesn't go out the way. So the only way to have a national clearinghouse where you can go to any doctor in the country would be if we went to a Medicare offer system. And, that has its pros and cons. I think it would be a great, because it would be very simple for people. But the problem would be doctors wouldn't make enough money unless Medicare starts to reimburse at a much higher rate. So doctors can basically only afford to see, they really need kind of a 1-to-1 ratio. They need to see one person with private insurance for every person on Medicare they see, because Medicare reimburses doctors at such a lower rate than private insurance company does, like, that people get from their employer. And so if we went to Medicare for All, unless they really increase those reimbursement rates, if it's government insurance, would take a lot more taxes. That's the issue. I don't know what the complete answer is, because I'm going to tell you right now, our health care system is still very, very, very flawed. And part of that healthcare system is insurance. The other part of our healthcare system is, how do you get care to the people? And so there's kind of two ways to go about that. It is just saying, hey, why don't we just give everybody insurance? And that sounds great on paper, just like Obamacare did. But the results weren't so great. And so, I hope we can get a better system than we got now, because I'm going to tell you, Obamacare is just murderous on the middle class. I mean, murderous. And our prescription drug dilemma here in this country is completely out of control. And so something needs to be done. Whether anybody will get in a room and get it done on a any sort of way that would make sense, I'm not really sure in this kind of political climate that we have. I'm not sure that anything can be done.
Yeah, words can fail you trying to get this done. Ruh-roh. Thank you for that.
I got a good idea. How about Aaron Zolbrod for president?
I had my time in politics, Ruh-roh. I know better.
Hey, Ruh-roh, thank you a lot. We'll talk to you soon.
Thanks, Ruh-roh.
Take care. 724-438-4593. I can, by the way, attest to that, because I lived in Florida when Obamacare went into effect, and they did not expand Medicaid.
I don't know. They must not. I'm wondering if they still have not expanded it.
They probably haven't. And there was a window there where you didn't qualify for Medicaid in the state, but you didn't.
It was horrendous. Actually, you and I had the discussion about somebody showing up at my office, and what it was over was because those people were calling me and they were upset. Yeah. Because I said, I can't get you any insurance because unless you want to pay $500 a month. And these are people that made, $1,400 a month. They couldn't afford that. Yeah. And I said, listen, you got to call the governor's office. They were the ones that decided not to expand Medicaid. Well, I sent about 25 people that started calling the governor's office and getting upset. And the next day I got a phone call from somebody at the governor's office saying, what are you telling these people to call our office for?
Well, because they need health care. That's why.
I said, because you guys are the ones that decided not to expand Medicaid, and I didn't know where else to tell them to call.
724-438-4593. If you have a question for Aaron on Medicare, Medicaid, your health insurance, if you run a business and you're thinking about either changing your coverage or adding coverage as one of the benefits, this is the time to call 724-438-4593, and we go back to the phones. Hi, you're on Medicare A to Z. Who are we speaking with here?
Yeah, Sonny.
Sonny?
Yeah.
How you doing, Sonny?
Pretty good. Hey, I want to talk to you about Medicare.
Sure, please.
I called this local store down here. I live in Cornersville.
Mm-hmm.
I called the store, and they said they're giving away flu shots. But when I went down there, they asked me if I had a Medicare card. I told them, yeah, and I'm on a Social Security.
Okay.
I'm on a fixed income. And I have an access card.
Uh-huh.
And they told me they can't get nowhere with Medicare on this card.
Well, your access card is not the card you need to use anymore, Sonny. It used to be you had an access card to go along with your Medicare card, but that was replaced by what's called a community health choices card that is either through UPMC, Pennsylvania Health and Wellness, and there's one other entity that is doing that, and the name slips by me, but that's the card you have to present with your Medicare card. Did you have your red, white, and blue card?
Yeah, I belong to Senior Life.
Well, that's why you couldn't get your flu shot, my friend, because all of your services have to be gotten through Senior Life.
Oh.
So you have basically, when you signed up for Senior Life, what you have done is you've made them your managed care provider.
Yeah.
And they provide you all your care. You cannot go get care out of their, without their consent, outside of their doctors who work with them. So you should be getting your flu shot from Senior Life. And that would, if they give it to you, that wouldn't cost you any money either.
I kind of figured that. I wanted to make sure.
Yeah, that's definitely the situation, Sonny. You've got to get all your care through them.
All right, that's about what I wanted to know.
Thank you.
Thanks.
Thank you, Sonny. 724-438-4593. And it's any question you have concerning Medicare. We've already had kind of two very different questions.
Sure.
About. It also shows the wide range of issues and things that people are dealing with their health care coverage. And as we've said, it's going to change, or it has changed.
And that's one of the problems that I have. It's so confusing. Sonny, it's so hard for people such as Sonny to understand the dynamics of their health care, and there's so, the different options. And that's what we're going to talk about today. We're going to kind of go back to the basics and get into the differences between advantage plans and supplements. Sonny has a form of an advantage plan. It's a little bit more unique, in the fact that, it's a little bit more a type of a unique advantage plan, but we are going to get into the differences between supplements advantage plans. And, I've been doing that almost practically from the first day we started doing this radio show 12 years ago. And we're going to do it again today because it's actually been a while since we've got into that.
Yeah, so we are going to get into the nuts and bolts, and there's a good time to do it because the annual election period is winding down. You've got how much time left?
21 days.
So 3 weeks.
3 weeks from today.
So, and you may say, it's 3 weeks from now. I got plenty of, no.
We can still fit everybody in. I mean, we've still got appointments. We've still got slots for appointments available. So there's definitely still time. somebody wants to have their plan reviewed and compare it to others on the market, or just a quick phone call too, sometimes is a good way to do it. If you're not already a client of ours, just to call down there and say, I've got XYZ insurance. Do you think I should come make an appointment? And we're either going to say, nope, you got a great plan. You don't need to do anything as long as you can afford it. Or we may say, oh my, you probably should come down. We feel like there's something that's quite a bit more competitive than what you have. And we can compare that side by side to others on the market.
And we're talking about both Medicare Advantage and supplement plans. Plus, again, we've got the prescription plans as well that you can look at and get that straightened out as
Absolutely.
well. So, give them a call. By the way, the office number is 724-603-3403. Our number is 724-438-4593. And before we get into the difference between Advantage plans and supplements, we go back to the phones. Hi, you're on Medicare A to Z. Who are we speaking with here?
This is Chuck.
Hi, Chuck.
How are you guys today?
We're doing good.
Doing
Thank
great.
you.
Hey, I have a question. My wife still works, and she's older than 65. She signed up last year for Medicare, Medicaid, and I'm younger than her,
Okay.
and I'm on her work plan.
Okay.
So does she have to re-up every year and say that she's on a private plan to Medicare?
Well, what she needs to do is make sure she's not paying for Part B, because there's no reason for her to have Part B if she's getting her insurance through her employer. So Medicare
Okay.
Part B costs $144.60, and next year it's going to cost $148.50. It's going up $3.90, and there's no reason to pay for that if she's getting insurance through her employer. She doesn't need to do that. Unless, the only thing I would say, with one exception, if you guys had like a $7,000 deductible, and she needed, and she was taking some, getting some treatments or taking medications that were all subject to that deductible, that would be the only way I'd say that she would want to sign up for Part B. But generally, most people who have work insurance, they have reasonable deductibles, $500, $1,000, $1,500, which are very reasonable. So that's one thing I would tell you. The second part to answer your question is no, she does not need to inform Medicare of anything. Once she decides to retire, then she can go ahead and enroll in Part B at any time she wants. And we actually have the forms that she would need to get filled out by her employer and to pass that on to Social Security in order for her to enroll in Part B at any time she wanted, and also ensure she would not have a late enrollment penalty.
Okay. Yeah, the reason why I wanted to know, because we need to fill out, her deadline is first week of December for her private insurance.
Yep.
I just wanted to make sure we're going to go through the process now to do the insurance.
Yep.
I just wanted to make sure she didn't have to notify Medicare.
She does not, and just like I said, make sure she does not have Part B.
Yeah, I'm pretty sure she does.
All right, great. And she did the right thing.
We have nothing
Yeah,
on.
she's doing a good job then.
Okay, Aaron, thank you very much.
Thank you. Thanks for the great question.
Thank you, Chuck. Thanks for joining us. 724-438-4593. Real quick, sidebar here, just because I hear this all the time. People refer to Medicare and Medicaid as the same thing.
It's not.
And it's not.
Right.
Just a quick thumbnail on that.
Medicare is, again, insurance that people get when most people get when they turn 65. Other people get it at 2 years after they've been awarded Social Security disability. Medicaid is for people who are very low income. To get Medicaid, if you're under 65, you have to make 138% of the poverty level or less. And to get Medicaid, when you have Medicare, you have to make less than $1,100, and you can't have more than $2,000 in assets, not counting an automobile and your home. Medicaid, for people who are under 65 and don't have Medicare, assets are not taken into account. So no, it's Medicare, and it's very common for people to get the two confused, but they are different. Thanks for bringing that up, Bill.
Yeah, and is there ever a time where you're doing both Medicare and
yes,
Medicaid.
it's called dual eligible. So for those people who are over 65 and make less, I think it's like $1,089 or $1,095, those people are what's called dual eligible. So they do have both Medicare and Medicaid. And then there are plans, Medicare plans specifically made for those people if you are dual eligible. We have probably 200 or 300 or 400 clients in that situation.
724-438-4593 if you'd like to get through and to ask a question to Aaron about anything having to do with health insurance. We are focusing today on Medicare supplements and Medicare Advantage policies because we really haven't, as you said, covered that in a while. And let's start off with the basic definitions. What is a Medicare supplement?
So a Medicare supplement is also known as a Medigap policy, which is a perfect name because that is what they're designed to do. There's basically 5 gaps in Medicare. 3 of them are in Part A. The first is if you have a hospitalization and you spend any period of time up to 60 days in the hospital, your bill would be $1,408. Anything past 60 days is billed by the day. And it's $352 per day from days 61 through 90 and $704 per day from days 91 through 150. So one thing a Medigap policy is going to do is cover those three gaps. The other gap in Part A is actually skilled nursing days 21 through 100. So if you have a skilled nursing visit and you have Medicare as your primary, the first days 21 through 100, if you only had Medicare, cost $176 a day. Again, the Medigap policy comes in and covers that gap. And then the third gap most people are very familiar with is the 20% of Part B that Medicare doesn't pay. And so again, a Medigap policy, a supplement, is going to come in and cover those 5 gaps. And that is how they work. They are secondary to Medicare. Okay, they're secondary to Medicare. So you show your Medicare card, and you also have a second card that is going to fill in those gaps. And we sell policies where you have little or not. People who have Medigaps plans have little or no out-of-pocket costs. We sell Plan G and N. Medigap policies are labeled with letters A through N. Okay, there's only 11 policies that you can choose from. We recommend G or N 100% of the time. With Plan G, the only bill you would pay is a $198 deductible, and once that's met, you pay nothing else out of your pocket. With Plan N, you pay that same deductible and nothing else out of your pocket, so you won't pay for blood work, x-rays, CAT scans, MRIs, hospitalization, surgical procedures, chemo, radiation, skilled nursing. The only thing you would pay for with N that you wouldn't with G is a small copay at a doctor or specialist of $20 and then a $50 copay at the emergency room, but nothing else.
And ballpark, what is it going to, I know it has to do with how much money you make and your age and things like that.
Well, yeah, Medigap policies are more age-based, Bill. So somebody, they're going to start at a female age 65 is going to start around as low as, depending on what county you're in, as low as $75 to $85. Up north, you pay a little less, and around here, it's going to start at around, they're going to start around $85 for a 65-year-old female, and a 65-year-old male is going to start around $95. And every year that you're older than 65, I'd say add about $3. So if you're 75, let's call it, 115, around 105 to 115 for a female, and around 115 or 124, about $125 for a male. Now, here's something that people need to understand is that if you buy a supplement, they don't come with prescription drugs like Advantage plans do. So you purchase that in addition. And next year, the average prescription drug plan is costing around $15 to $18. So you would add that on to those copays. So a female would be looking at between $100 and $110 at age 65, and a man would be looking between $110 and $120, or $115 and $125 in that ballpark when you consider the prescription drug as well.
Do other health issues play into the monthly cost if you're a cancer survivor or something like that?
Great question. No, they don't. So supplement companies, when you get a supplement company, and an Advantage plan company for that matter, you can never be picked on as an individual, okay? Because I have because I use my insurance, I have to pay more money than my neighbor does. It doesn't work like that. Basically what happens when you go into a supplement or an Advantage plan, you're going into a pool a large group of people. And if their insurance companies are making money, generally they're not going to raise rates. Now, when they're in danger of not making money, and it happens because just medical inflation is going to kind of whittle into their profits, so to speak, and so they're going to have to raise rates simply for medical inflation, as time goes on. But as far as your individual is your individual health having anything to do with your premiums when it comes to Medicare? Absolutely not.
And how does it work as far as our involvement in it? If we go to the doctor and they perform some blood work on you, and Medicare pays for X, and then the Y is going to be covered by your supplement.
That's correct.
Now, do we have to do anything as the consumers?
No, that's
do we
another
have
great
to handle
question,
paperwork?
Bill. No, and this is one thing we really like about supplements is the doctors don't bill two companies. Okay, doctors don't bill your Medicare and then turn around and send the bill to two places. So this is great. The doctor just bills Medicare. Then Medicare has it on file who your supplement's with, and then Medicare tells the supplement company what they owe and who they owe it to get the providers paid in full. So that's a really nice thing about supplements.
Anything else about how the coverage works that we haven't touched on? And also, I think we've kind of touched on the benefits, but any further benefits?
Yeah, let's talk about those benefits. And one is the coverage, because it's so simple, right? You pay your premium and very little else. If you take Plan G, we pay a small deductible. That deductible is going to be $203 next year, by the way. It's going up from $198 to $203. So with Plan G, you pay your deductible and then you're done. So once you pay that deductible, you don't have to worry about any other bills for the rest of the year. It's simple, simple, simple. With Plan N, once you meet that deductible, you know that no other bill should ever come except for a copay at a doctor of $20 and a $50 copay at the emergency room if you go there and you're discharged. And so the simplicity is one of the positives. That, God forbid, somebody gets cancer, and I've been stopped at the grocery store and had this situation said to me, "Gosh, Aaron, I want to thank you for getting this insurance for me, because I've had, I got diagnosed with cancer, and then I had chemo and radiation, and I had a surgery, and then we had scans and followed up with it, and I never paid a penny for that stuff." And so that's one of the positives. And another one is, with supplements, there are no networks. So you can go see any doctor or hospital in the entire country. We don't have to call up, but we just mentioned this, Bill. You don't have to call up a doctor and say, "Hey, do you take New Era life insurance?" Right. Or do you take Aetna? Or do you take AARP, which are the three biggest sellers of ours, are those three companies. Philadelphia American is a sister company of New Era, and I'm sure people are going to say, "Well, what about that?" And because we sold it to you if you have Philadelphia American, more than likely. So you don't call up and say, "Do you take Philadelphia American?" What you do is you call up and say, "Hey, do you take Medicare?" "Sure we do." "Can I make an appointment?" "Of course you can." Yeah. You hand them both cards and off you go. Here's something that people don't talk about, that doesn't get talked about near enough. Medicare decides what's covered. An insurance company does not. Okay, so private insurance companies, commercial insurance companies, and Advantage plans pay people, and they're the gatekeepers, kind of. So if you have an Advantage plan and you need to get an MRI or you need to get a surgery, that has to be prior authorized before you can get it. Those on supplements don't need to get prior authorization, because Medicare trusts the doctor's going to make the right decision and only tell people who need MRIs and CAT scans to get them. So if, Bill, you have a supplement, okay? If you and I were to go down to UPMC in the South Side, the sports complex, and we both thought we had meniscus tears, and we both saw the doctor the same day, that doctor's going to tell you, "Hey, Bill, we'll go back out in the lobby. We're going to send somebody out to get you an MRI." Right. And the doctor would tell me, "Aaron, we're going to call that MRI in, and somebody will call you when the insurance company gives the green light." Right. Okay, and that's the difference. So last week, I think it was Monday, I had somebody in my office who had a HMO Advantage plan, and listen, I want to make sure people understand that what he went through doesn't happen very often, but he was told he had to get 6 weeks of physical therapy before they'd give him the MRI. Okay, and so he did that before he could get it. With supplements, that never happens. Because, again, Medicare lets the doctor steer the ship. So we do get calls sometimes, and I just read an article about this, about how it was in some sort of journal for skilled nursing people who were in the skilled nursing industry, and it said on day 7 that the Medicare Advantage plan starts to determine if somebody should be in skilled nursing every single day. And that sometimes they'll call the nursing home and say, we're not going to pay for any more days. And they don't even take into consideration, Bill, if there's anybody at home that can help them, what their home situation is. Where again, those on Medicare supplements, if those people if the doctors that are in those homes say, boy, we really need to keep John here a few more days. There's nobody else. There's nobody at his home. He needs to be able to cook for himself and feed himself. He's not ready to do that yet. He needs to stay a few more days. Then that happens. So again, that's a very big deal. And here's something else. Benefits don't change with supplements. When you buy Plan N supplement, if you bought one at age 65 and you lived to be 90 and you bought Plan N, your copay will still be in the year 2050 will still be $20 at a doctor and still be $50 at the emergency room. And those are the only copays you will have. So they cannot increase those copays over time and they cannot add any, unlike Advantage plans. So that's something that we have, a long time of knowing, the security of knowing what my benefits are today and what they're going to be 15 or 20 years from now.
So basically, whatever rules, whatever you want to call that, when you sign up, are maintained, stay the same.
Supplements are highly federally regulated, designed to protect the consumer. I got to be honest with you, Bill. People who know me know I'm not a big government guy, know I'm not a big regulation guy. I think supplements are absolutely perfectly regulated. There's not too many and there's not too few. It's perfect regulation. I think we could use some more common sense regulation, especially with Part D plans. And also I would like to see a little bit more regulation with the Advantage plans.
Now, sometimes stuff happens, and you were saying that if you are on Medicare and a supplement, once you get any deductible and all that taken care of, that you shouldn't get a bill. But every now and then, you'll get a bill. So
the only bills you should get are for your deductibles, and that resets every January. So what I tell my clients to do is grab a little manila folder. They're a nickel at your, they're literally probably
out of the dollar store.
Right. You probably get, 10 of them for $1. And you just keep your bills in there until they get to what the deductible is. And you write them in the inside flap, and those bills should be $203 next year to the penny. But sometimes, like you said, you will get a bill that's in error. Right. And that's where our clients are pretty spoiled, because they can just pick up the phone and call us and say, hey, Aaron, I paid my deductible. I got bills for $203. I just got another bill for, from a lab for $460 for an MRI, right. And we'll pick up the phone and call them and fix it. Because again, that's part of the simplicity of knowing that it's so simple what you need to pay, and that anything else that comes over and above that is 99 times out of 100 erroneous.
And if you'd like to ask Aaron a question, if you have questions about supplements or Medicare or any kind of health insurance issues, you can call us right now at 724-438-4593, or you can call the office, the health insurance store in Connellsville, 724-603-3403, or online at getyourbestplan.com. Now, we're coming to the end of this hour, so this may be something that we carry over into the next hour. But we've been talking very positively about supplement plans, Medicare supplement plans, and it sounds great. But as with everything in life, there's also got to be a downside. So what are the negatives?
Well, the first one is the cost, obviously, because Advantage plans you can buy for nothing. I don't know if you can call
we
them
see
buy.
them at Joe Namath keeps telling us about
I don't know how you can say you can buy them for nothing, but you can get them that don't cost anything. We're going to talk about that. How can that happen in the second hour? But so, I just talked about how a 75-year-old could be paying, $135 for one of these over 12 months period of time. That would be about $1,600 in premiums.
Yeah.
And if you took an Advantage plan and you could get for $0, if you stayed relatively healthy, there's some money to be saved. And over a 5-year period, if I spent $1,600 a year over 5 years, that's $8,000. And if I had a zero premium plan or lower cost premium plan on a Medicare Advantage plan and I stayed healthy, well, I could save that. I can save that money. So, supplements are costly, and they are going to go up as one ages. That's why I said, for a 95-year-old woman, it starts at around, generally in our area, it's going to be around $95. And we said in 10 years, it could be $125. And when we get people, and as you get older, they start to increase faster. So at age 75, you're going to start to see these premiums go up more in chunks, $15 and $20 at a time, as opposed to $3 or $8 or $9 at a time. And we have people, again, that get priced out of them, Bill.
Right.
So at age 85, we're creeping up to $250, and at age 90, we're in the $300 range. When they become a lot less, the value of them is not as great. The value is fantastic at $100 to $125, $150, but when you get up in the $250 range, the value is not so great anymore. And they can and they will. It's not a matter of if they're going to go up; it's a matter of when and how much.
And just like your Medicare payment is going to go up every year.
Yep. And so let's talk about a couple other ones. Another disadvantage of supplements is they don't come with cosmetic, dental, vision, hearing aids, over-the-counter benefits, or the Silver Sneakers gym membership that Advantage plans do. So you would pay for, now when I say no vision, dental, or eye, I mean vision, dental, or hearing, I mean the cosmetic stuff. So they're not going to pay for cleanings or crowns or root canals or fillings. They're not going to pay for eyeglasses or routine eye exams. They're not going to pay for hearing aids or routine hearing exams. They will pay for medical conditions of the ear, eye, or mouth, glaucoma, cataract, but they're not going to pay for the cosmetic stuff, which Advantage plans are very generously right now. So a lot of people like to get that stuff, and supplements don't come with that. You're either going to, you're generally going to pay out of pocket as you go for that, because there are really no good dental, vision, and hearing plans when it comes to buy on your own. I've been choosing to buy. I've been looking for one to sell for years and years and years. I could make a small fortune selling dental. I just never have. I do want to address that. I do want to kind of address dental at some point in the show, Bill, because people are always asking us about that. So if we have a few minutes, maybe next hour after we get through with the Advantage plans, I want to go into some dental and vision and what people need to be thinking when it comes to those.
Because those are they're available, but
that stuff is available with Advantage plans, but not supplements. And so many people like to buy supplements, but they always ask me, what do I do about dental and vision?
Right.
We'll get into that next hour. Another disadvantage of supplements, and again, no pun intended here, we're talking about Advantage plans and disadvantages,
right.
Is that they can be medically underwritten. So this is very, very, very important for those of you who are going to be turning 65 soon to understand, or those of you who are on Advantage plans currently need to understand. If you want to move to a supplement, you cannot just say, okay, I want one now, and get one. They're medically underwritten, meaning you have to answer a series of medical questions. And if you can't answer those questions, no, the supplement companies do not have to accept you. They are allowed to discriminate based on current and pre-existing conditions. And so if you've had, certain cancers, if you have AFib, if you have heart disease, if you have COPD, if you're insulin dependent diabetic, if you have an autoimmune disorder, they are not going to accept you. So people very mistakenly think, well, I thought Obamacare fixed all that. It did for people who are under 65. It did not for people who are on Medicare, not supplements. Now, again, Advantage plans have to take everybody. Supplements do not. Because Medicare is primary, and Medicare does accept everybody, Medicare allows supplement companies to, again, discriminate based on they can pick and choose who they want based on what a risk they think you are. Obviously, the more risky you are, AFib obviously is considered to be very risky. An insulin-dependent diabetic, it could have some, many more underlying conditions. They consider those people to be a risk, and they are not going to choose to cover them at all. So that is a negative, and you have to realize that when you go in and make your decision. The first time you go on Medicare, it's so important to keep that in mind. And we always encourage people, say, listen, you don't necessarily can make your decision based on your health today, because we don't know what could happen a year or 2 or 3 years down the road and what you could be diagnosed with. You can't just say, if I get sick, I'll go back to a supplement. No, that doesn't work like that. Okay, I want people to understand that.
Now, that being said, Medicare is not medically underwritten.
Everybody gets Medicare. And everybody can get an Advantage plan, too, which we're going to talk about next hour. So we're going to come back next hour. We're going to talk about how Medicare Advantage plans work, how they differ from supplements, what they cost, what the coverage is, and also the pros and cons like we just did for supplements as well.
I'm taking your calls at 724-438-4593. Hour number 2 of Medicare A to Z with Aaron Zolbrod is up next right after the news on your local station, W266DB, WMBS, Uniontown. Your local station, WMBS, hour number 2 of Medicare A to Z. From the health insurance store, Aaron Zolbrod with us, taking your calls at 724-438-4593. And again, if you would like to talk to the folks at the health insurance store, 724-603-3403. Now, don't ask for Aaron right now because he's here in the studio, but you can talk to Aaron any other time at the health insurance store or one of the many different people that you have that are all willing and knowledgeable and will help you out at the health insurance store. Also, getyourbestplan.com if you want to go online. And again, you're maintaining all the CDC protocols, so you can do Zoom meetings, you can do it on the phone. And if you want to come into the office, you're doing the social distancing and the mask thing. So It's all
plexiglass, the whole nine.
It's all good. And again, we'll take your calls at 724-438-4593 if you have a question for Aaron regarding anything to do with health insurance, Medicare. If you have some question about supplements, we have been talking about supplements in the first hour, and we'll continue with that and then get to the Medicare Advantage plans, and we'll take your calls here on Medicare A to Z on your local station WMBS. When we left off, we were talking about Medicare supplement plans. And, the positives, the negatives, and all that. But what type of people are looking at supplement plans? I mean, what are the categories they fit into?
So supplements, again, because they're so predictable, people who are more conservative tend to take supplements because, again, they know what they're going to pay in any circumstance. Basically, your premiums and hardly anything else. So there's just not much out-of-pocket cost to worry about. So people who take supplements are tend to going to be more conservative. They don't want to get into taking a chance with Advantage plans, that they're going to save money because they're concerned that maybe if they get sick, they could end up with big bills. People who travel a lot need supplements. People who have a house in Florida almost have to have a supplement, have winter homes because they need to be able to see doctors while they're in Florida and also when they're back home in Pennsylvania. So that's very important. And those are the people who take supplements. Really, more people who turn 65 for the first time. So I'd say 9 out of 10 of people we meet for the first time, when we go over the pros and cons of supplements, generally take a supplement. And that's who take, because they're so affordable too at age 65, Bill. And that's another reason why so many people at 65 will take them. But I think the more conservative people that take the more conservative approach, for sure. And again, let's say you have some conditions that you carry into Medicare, like high blood pressure. Well, not high blood pressure, but that's a great point. Thank you for bringing that up.
Or the diabetes.
People who take supplements, people who are coming into Medicare with some of those knockout conditions. Like when I say knockout, means it would knock you out in the future of getting a supplement. People who I meet who have COPD when they're going on Medicare for the first time are insulin-dependent diabetics, do have autoimmune disorders. They almost have to go on supplements, Bill, because it's their one and only crack to get in one. And if they don't take that opportunity then, and they go with an Advantage plan and remain on it over a year, they can never go back onto a supplement. So, yes, that is a great point. And thanks for asking that question. Those are the group of people that take supplements too.
And are there any other people that tend to take the supplements? Again, I think we can't say it enough that you may have only one shot to get into a supplement.
You do only have one shot, unless the supplement company goes out of business and folds up their tent or gets their doors locked up, chained up by the IRS one night.
That's not good.
Which I have never seen happen in 13 years of doing business. Yeah. Generally, another company would come in and buy them out before that would happen. But I have never seen that happen. So no, when you take a supplement, there is going to be almost no circumstance. If you don't take it at 65, there's almost going to be no circumstance where you can just get one without them asking medical questions. Now you can always switch, and we switch people all the time from one supplement letter to the next, or from Advantage plans to supplements. And those are the people who can answer those medical questions. And I don't want people to just, I have high blood pressure. No, that's not what they're looking for. They're looking for big stuff, And even if you had cancer 6 years ago, even 4 years ago, or even 3 years ago, you can still get a supplement depending on what kind of cancer it was. So don't think you can't get one. If you want a supplement, if you're interested in one, don't say, I won't be able to get one. That's not true. There are different companies, and they all ask different questions, and all look back a different amount of time. So a lot of times you may not qualify for one, but we can get you qualified for another, because they all, again, have different medical underwriting guidelines.
Is there anybody you would say doesn't need a supplement? I mean, I can't imagine, because there might be people out there, I can just pay the 20% myself. And
Listen, more power to those who, we're going to get into those who would take an Advantage plan next, and more power to those people. Yeah. If you listen, we explain the pros and cons, the risks and rewards of all plans. As long as we've explained the risks versus the rewards, and you're willing to take the risk for the rewards that not going with the supplement offer, we are just fine with that. But far too often, Bill, people are going out and buying these things, just calling the company that they retired from, or calling the Joe Namath number on the television set, or Franco Harris, or whatever. Jack Ham's now doing one. I mean, whatever. Pro football players.
They know their market.
Yeah, I mean, I wake up to these commercials every day. A lot of times, I wake up in the morning and then come home and, maybe fall back asleep after I drop my daughter off. And I swear to God, every day I wake up to these Medicare commercials, and calling those numbers is not a good idea, because you're not going to have all the risks and rewards of both style plans taken care of.
And you will also probably more than likely be talking to somebody whose number one job is to sell you this plan.
They don't get, most of them are agents like myself, and they don't get paid unless they do sell you something. And they could be in any state. They're not necessarily local people either.
Right. They could be in a state of disrepair.
A drunken state.
724-438-4593. We will get into Advantage plans, but first we go back to the phones and say hi. You're on Medicare A to Z. Who are we speaking with here?
Hey, good afternoon. This is Michael.
Hey, Michael.
Michael.
Hey, while you're speaking of Medicare supplements, I'm currently on a Plan G, and I just turned 65. Should I stay in Plan G the rest of my life?
Well, Michael, it's a great question, because I tell people that they need to choose their plan at age 65 like it's the only plan they're going to be on for the rest of their life, because even if you're the healthiest person in the world at age 65, we don't know what could become 6 weeks, 6 months, or 6 years down the road. And so, why I do a lot of Plan N instead of G is because it starts lower, and I believe the lower we start, the longer it's going to stay lower. Okay. And that's why I'm a really big fan of N for those who don't go to the doctor, go to the doctor less than 12 or 10 or 12 times a year, because I think that N's going to remain lower for a longer period of time and end up being the better value. Now, there are people who like G. I get tons of this. I don't want to deal with paying a copay. I want to just get my deductible done, and I never want to get another bill. It's simpler for me. There's something to be said for that simplicity. That simplicity in 10 years could cost $1,000 extra a year than N would. I'm predicting that Plan G in 10 to 12 years will be $1,000 a year more than N. And when we look at it in those terms, at a $20 doctor copay is pretty much the only difference. That's 50 doctor visits you'd have to go to for Plan G at that point to be as cost effective as N. And so again, that's just how I run it through my mind, as far as the difference between, who should take G, who should take N.
Related question, what made me blink in helping out my parents and whatnot is that I noticed for their Advantage plans that the co-pays went up dramatically, to some as much as $184 a day. How are co-pays under Medicare supplements? What are they?
There are none. There simply are none. If you take Plan G like you have, Mike, there's just no co-pays, because the co-pay for Medicare today for days 21 through 100, which you're referring to on an Advantage plan, are $176 a day. That'll go up a little bit next year, probably to $180 or something. So there are no co-pays, because Medicare would pay everything but $176 $176 a day, and then the supplement would come in and pick up that $106. So there would be zero copay for days 21 through 100 in a skilled nursing facility. So, for example, if you had chemo, Medicare pays 80%. If it's $10,000, they'd pay $8,000. Your supplement would come in and pick up the other $2,000. And the only copays for supplements we sell would be just for, if you took Plan N, would be just for a physician's office visit, or the emergency room of $20 and $50. So you don't even pay that copay when you have outpatient rehab or you got blood work done or there's a procedure involved. There is no copay. It's just a physician's office visit. And again, that's the beauty of supplements, and is we know what you're going to pay in any circumstance. You could have $200,000 worth of chemo and radiation and surgeries, and you would never pay a dime with either Plan N or Plan G.
Well, to me, the TV repairman just left here 2 hours ago, and I was trying to explain him the difference. I think I told him correctly. You correct me if I'm right or wrong. I told him that I believe that when you have a Medicare Advantage plan, even if you're in a nursing facility for a short-term rehab, your doctor does not make the decision whether or not you stay in the nursing home or you go home, as opposed to a supplement.
That is 100% correct.
Okay.
And I just mentioned that, Michael. I don't know if you caught the first hour, but somebody sent me something from a journal, some sort of journal that people in the skilled nursing business read, and somebody puts it out and sends it to people who are in that business. Okay. And it was a client of mine who said, thought that this might interest me, and sent me and said that Medicare Advantage plans start to evaluate every single day whether they feel that person should be in a skilled nursing facility at day 7. And every day they take a look at it, every single day, where Medicare will never I think it said Medicare doesn't even look at it till 27 days.
Yeah, I don't know if you happen to see this, but what got my attention in Sunday's Tribune was the fact that one of the nursing homes in Squirrel Hill with a better reputation of the Jewish faith, they're shutting down. And January 1st, and the reason why? Because of the Medicare reimbursement.
Really?
Yeah.
And that is a shame.
Yeah.
And that is a shame. And that is one of the perils of going to a Medicare for all is, can we continue to can we fund, and so smart people, good people with integrity will stay in the business. And that's the scary part. The biggest, scariest part to me about a Medicare for all is that. Do we not pay doctors well enough that we run them out of business? Or, like you said, that these have some good reputations. That's awful. When we lose one of these homes that has a good reputation, check it out. It's on the front page of yesterday's Tribune. You probably could check it out online. I will do that. Thank you, Michael.
Because they were talking about the impact, of the CARES Act on when that money goes away. The nursing homes are really going to scramble to who's going to absorb those costs of continued COVID testing.
Yeah, it's scary stuff.
Yeah. Okay.
Thank you for the great phone call.
Thank you, Mike. 724-438-4593. Yeah, I saw that story. Something like, I think 120 people are, unless somebody comes in, and this is a probability, and buys the unit or takes it over. There's 120 people, some odd people that are going to be.
That's terrible. I hate to hear that.
Looking for a new domicile. 724-438-4593. If you want to talk to Aaron here on Medicare A to Z. Again, if you want to call the health insurance store in Connellsville, 724-603-3403. And we have been talking about Medicare supplements and Medicare Advantage plans, and now it's time to just toss out the question, what is an Advantage plan and what's the difference?
So an Advantage plan is not, let me tell you what it's not first. It's not secondary to Medicare. It is not designed to fill in the gaps of Medicare, okay? It's designed to pay in place of Medicare. So Medicare basically pays everything but $1,400 of your hospitalization, and Medicare pays 80% of your outpatient services and procedures. When you choose an Advantage plan, you're choosing to privatize that Medicare, and Medicare will then stop paying that 80%, and they will stop paying for your hospitalization minus the $1,400. And what they do in lieu of that is they're going to pay a private insurance company of your choice around $800 a month to become your one and only insurance company. Remember we said, well, we were going to talk about how you can get a zero premium? Well, that is how. Because these companies are receiving approximately $9,600 to $10,000 a year to take on the burden of insuring somebody, insuring a Medicare recipient. They are, for lack of a better word, they're paying somebody. They're paying a private insurance company. Medicare is to get rid of them. Okay, they're paying a private insurance company to provide their health insurance and to pay all the bills. Minus, here's where the fine print is. Well, it's not really fine print because it's well known, but they're paying them to pay all. They're going to pay all the claims minus your cost sharing. So we said with supplements that there's almost little or no out-of-pocket cost. Now with Advantage plans, we're going to generally have copays for blood work and X-rays and CAT scans and MRIs and hospitalizations and surgical procedures and chemo and radiation and skilled nursing. All those things that Medicare would and a supplement would pay, you're going to pay with Advantage plans. And so a lot of times when I explain that, somebody will stop me right there and say, Aaron, why would anybody do this? Remember, again, we can get premiums for as little as $0. So, if we can save $1,600, $1,200 to $1,600 a year, even more for somebody who's older, then, that's why people will do it, to save money on premiums. But that is what an Advantage plan is. You're privatizing your Medicare. And you're choosing, there are 7 companies that compete to get that money here in Western Pennsylvania. I'm not allowed to name those. It's weird because I can name supplement companies, but I am not allowed to mention names of Advantage plans companies. Strangest thing ever. I don't get it, but it is what it is.
And but let's say they happen to probably have a fairly large television budget.
They do. Many of them have a very large television budgets, and they send those ads that you're getting, the solicitations that you're getting in the mail this time of year are generally for Advantage plans. Yeah. Those commercials that are, Joe Namath pitches and, free this and free that, and zero this and zero that, those are Advantage plans. They're not supplements. Okay.
Yeah. The political ads and the political mailings stopped. The Medicare mailings and the
doubled. Yeah, they were already coming hot and heavy, and now they doubled. So let me explain what they are. Now, these are HMOs and PPOs. Okay, so that's the difference. Supplements are neither. Supplements don't have hospital networks. Advantage plans do have hospital networks. And if you want to know whether you've got an Advantage plan or supplement, the simplest thing to do is look in your, open up your pocket, your purse or your wallet and see what your card says. If it says HMO or PPO, you do have an Advantage plan.
Okay, if you have a Advantage plan and you still have co-pays, can you get a supplement for that?
No, that's another great question. You cannot have both.
Right.
It's illegal for an agent to sell somebody both an Advantage plan and supplement, and they can't work simultaneously. You can only have one. Now, I've had people who have bought Advantage plans and forgot to cancel their supplements.
Right.
Once that happens, you're paying for a supplement. The supplement's not paying any bills.
Right.
So you're just paying for the supplement, and the supplement's not going to come in and pick up your $300 copay for an MRI or your $25 copay for a blood work. For an X-ray. It's not going to do that. You're just paying for a supplement for nothing because you cannot have both.
So you're off.
You cannot have Medicare pay 80% of your bill and also pay a private insurance company $800. You'd be double dipping.
Yeah, that may not make a whole lot of sense. Now you said that we can go with 0% premiums.
Zero premiums. Yep.
$0 premiums, yes. Rather. But I imagine you have to jump through some hoops for that. And so, on average, in the real world, how much do these things cost?
Zero premiums are available to anybody, regardless of income, Bill. So they are available to anybody. They're generally going to have. Some of them are generally going to have. The ones that come with prescriptions, Bill, are generally going to have higher copays and higher out-of-pocket maximums. But here's another thing you need to know about Advantage plans. You should never pay more than $50 for one. Right. Once they get to around $50, paying anything more, all you're doing is providing insurance company with pure profit. Yeah. There's plans are out there that are $100, $200, and $300. They are no better than plans that are $50 or less. In fact, the value is horrible on those plans because you're going to spend $3,600 in premiums. You're not going to get $3,600 in value back. In fact, the most expensive Advantage plan on the market is over $300. If you wound up in the hospital or excuse me, if you needed chemotherapy and you had 8 or 10 chemo treatments, you would pay more money out of your pocket with the $300 plan than you would with the plans that we're selling the most for 2021 that are $50 or less. And that is insane, but that is just Medicare Advantage, the madness that is Medicare Advantage, and why I feel Medicare Advantage really needs to have some more regulations. And one should be that there should never be an Advantage plan that costs more than $100. That should be the cap on what they should cap them on what they can be paid for, because there are seniors who don't understand. They're not getting a value for their money. There are seniors who think you get what you pay for, and they can't read the differences between the plans, and they're being taken advantage of. And again, that's where we need some extra regulations.
I'm trying to figure out why you would spend $300 a month on an Advantage plan when, if you just get straight Medicare,
you could get a supplement for $125.
Right,
because Bill, this is the confusion that is Medicare, and unfortunately, again, this is what bothers me about Medicare, and this is one of the arguments for Medicare for all, is that we should make this simpler for people, especially people in their 80s. I'm kind of under the feeling that I think once somebody gets to 85 years old, they should get Medicaid. That's kind of my opinion. Anybody who's 85 should not have to make this decision anymore. They should be able to get a plan where everything's paid for at 100%. If they want to get private insurance and buy a supplement, then so be it. But if they wanted to go on their state's Medicare program, that's how I think, because the older people get, the more confusing this gets, the harder it is for them to make a decision, the more fearful they become of making changes, and that's when they end up getting taken advantage of. And I've seen it for 13 years, Bill. I've seen seniors overpay for Medicare plans for 13 years. Yeah. I've sat with people and I've showed them side by side, here's a plan that's $285 and you could be billed $6,500 if you got chemo, and here's a plan that doesn't cost anything, you could be billed $3,500 if you got chemo, and your copays are almost identical across the board, and they'll look at me, Bill, and they'll walk out the door and keep their plan.
Because I can't change it. I've had it this way for 10 years or whatever.
And when my husband had his surgery back in 1998, we didn't get a bill. And so the fear is if they change to another plan, the bill might be $40,000, and it doesn't work that way due to regulations. But this is how some people's minds work, and it's very frustrating to watch seniors who are on fixed incomes overpay. But it happens all the time.
And let us also be honest. You mentioned this, and I've heard you mention this before, that there are companies that take advantage of this.
Oh, for God's sakes, yes.
That are the resistance to change that comes.
They know
with
it.
People.
They know it. They know it. Again, that's why we need some regulations. Again, I think if it was up to me and you told me to regulate it, I'd make all 3 Advantage plan companies. You could offer 3 plans and 3 plans only. Everybody has to offer a plan that's $0. Everybody has to offer a mid-range plan that's 50 or less, and everybody has to offer a high-end plan that's either that can be from 51 to 100, and that's it. And then people can look at all companies side by side. I mean, there's companies, Bill, that have 25, 26, 27 Advantage plans. Some are based on the county. They're specific to your county. Some are specific to what hospital you use. The books are thick. It's just, again, you can avoid all this by letting us help you with that. Obviously, that's what we do. Yeah. I have people that just come to my office every year and they say, Aaron, what are we doing this year? Well, I think this is best. Okay, if that's what you say, this is the trust we built in this community over, a period of 13 years, and we will always make sure our clients are always on the best possible value, and we will never let our clients overpay for Medicare plans, ever, ever, ever.
And again, this is the advantage of having somebody who is not a captive broker, and you can set up a spreadsheet and say, if you go this is how much you'll get. If you go this.
Side by side, here's how much your copay is for blood work.
Yeah. So
A, B, and C. How much dental you get. A, B, and C. Here's how much if you're in a skilled nursing facility over 20 days. A, B, and C. Here's what happens if you get cancer. Here's how much money you could be billed. A, B, and C. And look at them all side by side and help you make that decision.
So you mentioned that it's an HMO PPO type of thing. Is that how the coverage works, just like an HMO?
Yeah. So let's just HMO is not a bad word,
right?
Okay, like it used to be in the late '80s, mid '90s, where a doctor had to give you a referral and you couldn't go to the chiropractor unless your primary care doctor said so. I can remember, I think it was 1994, being laid up on my couch. My primary doctor's on a fishing trip, and he's not coming back till Tuesday. And here it is Thursday, and I can't get off my couch. And, I've been one of those guys that for all their lives can go to a chiropractor once or twice and be fixed.
Right.
And I sat there for 6. It doesn't work like that anymore. You do not need a gatekeeper. You do not need referrals. All an HMO means is you must use doctors in network. You can go see I can go see an oncologist. I can go see an orthopedic doctor. All I need to do is make the appointment with a network provider, and I can go see that. PPO means I can leave the network. I still have a network of preferred providers. That's what the 2 P's stand for, preferred provider, and pay one set of copays. But if I leave the network, I'm going to pay a lot more money if it's if I'm going to leave the network voluntarily to have a surgery or some sort of a doctor visit or procedure or surgery voluntarily out of the network.
Do you also find what happens with other HMOs and PPOs that if you for some reason need a medical procedure and you are out of state, let's say you go visit Florida?
Well, in an emergency, what's nice about HMOs and PPOs Advantage plans is in an emergency, you are going to get treated like you're home. So they're going to pay the same amount they would have paid had you been in Uniontown Hospital, had you been, if you were, at a Pirate game and you got ambulance to North Side, probably is where they take you right up the hill to North Side to Allegheny.
Watch out for those foul balls.
Yeah,
by the
Allegheny
way.
General in the North Side, they would pay whatever you had paid, or if you were in Florida, got stung by a jellyfish, and you needed to have a procedure done, or you broke your leg, they're going to pay whatever they would have paid here. Now, there's a catch to that, though.
Yeah.
Is that if the going rate for that in Miami Beach, which it probably most certainly is more for a broken leg. It's $6,000 here and $7,500 there. That hospital has the right to come after you for that $1,500. Now, they have to pay the same they paid here, and it's in network. But there are some situations like that again where supplements that does not happen. They have to accept whatever Medicare pays and the supplement pays as payment in full. That's law.
So now, is there anything else we need? Because I think, especially if you've been on a marketplace plan, HMOs and PPOs, and because most of the plans there.
So I will say that the networks are excellent in Western Pennsylvania, so we don't need to worry about that. Yeah. The most popular plans cover everybody but Allegheny Health Networks, and that's not a big deal in Fayette County because, we have our local hospitals, and then if we needed a major surgery or something our local hospital couldn't do, we can go into and use UPMC Health Networks. In the other popular plans have both systems in network. I have basically every hospital in Western Pennsylvania in network. They have most of them have Ruby in network, even in West Virginia locally and in West Virginia. And then a couple of them even have the Cleveland Clinic in network, Bill. So we are not finding doctors, just an occasional podiatrist, an occasional chiropractor who's not in network, but never primary care doctors and never specialists. With most of these companies. So that's the network's not an issue. It's just an issue for people who want to be able to, say, go to MD Anderson if they got a rare form of cancer, which I've had several clients go and had their lives saved. We had a client, I'll never forget her as long as I live. She, at age 65, not long after she got her supplement, she got a rare parasite from tainted romaine lettuce. There was only 2 hospitals in the country that could treat her, the Cleveland Clinic and the Mayo Clinic. There she went to the Cleveland Clinic for 115 days. Lived to tell about it. I touched that bill. It was $250,000. She never paid a penny. She had a supplement. Okay. Now, at the time, the most popular Advantage plan on the market, Cleveland Clinic wasn't in. Now it is, but then it wasn't. She could have died. Okay. So again, I have lots of people say, listen, Aaron, if I can't get my care here in Pittsburgh, I'm not going to I'm not going to Cleveland, or I'm not going to Minneapolis to the Mayo Clinic anyway. So you can just dig my grave and put me in my casket now because I'm not willing. And that's fine if that's how you feel. There's plenty of people that do that. But again, to each their own, right? And this is where we come in and we sit down and we talk to you. How do you feel about these things, and kind of match you up with a plan.
So we've kind of danced around with some of the benefits and of the Advantage plans, and again, especially if you listen to all the ads, they also include things like dental and vision plans.
So let's talk about what's good about them. Obviously, the cost, right? Those people who say, okay, I'm not going to pay $150 a month. That is $1,200. That's $1,800 a year. Let's call it $2,000. Over 10 years, I can save $10,000 in premiums. And if I stay relatively healthy, and when I see relatively healthy in that 5 years, you could have had 3 or 4 hospitalizations, 3 or 4 surgeries, 8 emergency room visits, 20 trips to your specialist, and you would indeed save a big chunk of money. And so that is the number one reason, in my opinion, to take one. is the prospect of saving $6,000 to $10,000 over a course of 5 years. That would be why you'd want to do that. So that's the number one advantage. Number two is you're going to get all that stuff that they say on the TV, for the most part, is true.
Yeah.
Rides to and from the doctor, gym memberships, over-the-counter items where you order. This is a new benefit, started last year. It's super popular, where you get a catalog and you can order any vitamin that you could possibly imagine. You can order, one company has Crest toothpaste in it. You can get, cold and cough remedies. You can get braces for your ankles, your knees, your, elbows. You can get thermometers, blood pressure monitors, electric toothbrushes, mosquito repellent, sunscreen even. So, anything you can walk into a CVS and get off the shelf is in these catalogs. And some companies are giving you, I would call it in real dollar value about $50 a quarter. In real dollar value, a couple $100 a year to order this stuff. The dental now is fantastic. I'm telling people, if you're not on a plan that provides comprehensive dental right now, you're on the wrong plan.
Right.
Your plan should cost less than $50 and should come with at least $2,000 worth of comprehensive dental. When I say comprehensive, it used to be when these guys said dental and vision, they were referring to 2 teeth cleanings and maybe a set of x-rays that you'd pay $15 for. Now it's 2 free cleanings, 1 set of x-rays, and then they'll pay, depending on what county they'll pay between 50 to 80% for fillings, extractions, and periodontal, and they'll pay 50% of root canals, crowns, partials, and dentures, up to $2,000 or $3,000 for the year. That is legitimate dental, almost exactly the same as what I buy for my employees. So that is nice. They're going to give you, from anywhere from $150 to $300 for a pair of glasses and a free eye exam every year or 2 years. You can get hearing aids now with these, and some they're not the greatest hearing aids in the world, but for some people it might be better than nothing.
Now, do you have to deal with people in network on these too?
Yes, of course. So not every dentist is in network. One company has really, I'd probably say 85% of all dentists are in network, and the other company about 50% that's providing, that we are selling, that provide these things. The rides to and from the doctor, that's real. Yeah. The meals when you get home from the hospital, they'll provide you with 14 days worth of lunch and dinners if you're discharged from a hospital or a skilled nursing facility. I've had somebody say they tried the food; it was actually decent.
Always a plus.
So I did the math on this, Bill, and again, I've looked at this when I'm talking about, especially when I write my columns, and if you want to find those, they're in the Post-Gazette every Friday on page A2, and then the Trib every Tuesday on A7. But I talked about if you used your gym membership, which is a $35 a month value, if you just got 2 teeth cleanings and a set of x-rays, which is about a $200 value, if you used up the majority of your over-the-counter, if you used it all, which is about a $200 real dollar value. If you got $250 for a pair of glasses, you're getting about $1,000 real dollar value worth of goods and services in a calendar year. So add that to the savings of the premiums. And now here's the thing though, we gotta hope that those benefits continue to be that generous.
Right.
These are all new. The dental just came back. Listen, we went from 2009 to 2018 where nobody offered any dental except for a couple cleanings. Okay, so this is new again. The over-the-counter benefit, the over-the-counter thing is almost brand spanking new. Last year was the first year it was available to the public. Okay, so we don't know if these things are going to stick around or not. I had a conversation with a big, pretty high up at an insurance company today. He said, Aaron, there's just only so much money we got.
Yeah.
And my concern is once they start to give you more benefits in the dental, vision, and hearing, that might mean your copays for medical services may go up.
Right.
They got to kind of rob Peter to pay Paul, so to speak. Remember, insurance companies, be that supplements or advantage plans, are for profit.
Right.
Okay, they have a board to answer to.
That's not a bad, but they're also for profit means competition, and they will.
That's exactly and that's exactly what's gotten the dental benefits and all these over-the-counter benefits so excellent. So to be so generous is the competition has become, fast and furious.
I imagine that we're edging into the negatives here, but if they can change them like this, that means they can also take them away.
They will, and they do, and they will.
Yeah.
I mean, it's just a matter of time. Either you're going to either. So, we're kind of have a few companies that are giving us the best of both worlds. Low copays, low premiums, and great dental benefits. So in the future, it's going to be a choice. Do you want to take the dental and maybe pay higher copays? I'm hoping maybe they'll give people a choice. Okay, you can have a plan that offers all this stuff and have higher out-of-pockets and higher copays, or we're not going to give you any of it, and we'll keep those copays and that out-of-pocket down. So I am a bit concerned about what the future holds as far as those ancillary benefits. And that's what we call them, Bill, ancillary benefits. They're benefits that are voluntarily provided. They do not have to provide them. Okay? Medicare Advantage plans have to cover everything that Medicare covers as good or better than Medicare does. Okay? And 90% of the time, it's better than Medicare does. These are ancillary benefits that Medicare doesn't demand that they offer. They are doing it on a voluntary basis to be competitive.
So, are there any other benefits we haven't covered and some negatives we haven't?
One more benefit is your prescription coverage comes with it, generally. Unless you have PACE or PACENet or you're a VA, you generally get a plan that comes with medical and prescription, and the prescription drug benefits are outstanding. They are better than those that people on supplements buy because there's no deductible on brand name drugs. So the drug coverage is excellent as far as if there's no deductible. As far as negatives, we're dealing with networks. Okay. Please beware if you have an agent tell you, we have this new out-of-state thing. It's not as simple as just going to wherever you want to go. Okay, you have to get permission to go. The company has to call the doctor, make sure that they'll accept payment as payment in full. It's not that simple, trust me. So if you do some traveling, really, honestly, I don't think an Advantage plan is for you. Again, if you needed, if the Mayo Clinic, or excuse me, if the MD Anderson was the only hospital that could treat your type of cancer you have, and you have an HMO, you're not going unless you have a couple $100,000 sitting in the bank that you could pay them. Okay? Benefits can change. My biggest fear. Okay, we take this plan today. You're 65. You took it because you're healthy and you got this great dental and you think you need a root canal next year. And it's time for to get some glasses and you love the idea of ordering all that stuff out of a catalog. In 2 years or 3 years, our hospital copays got higher. The maximum out of pocket got to $7,500. A hospital copay is now $1,000 for a 5-day stay. You take a look at this thing and you don't like it, or you get sick. You get sick in 1 year, you get bills for $4,500 or $5,000. You call me up and say, Aaron, I don't want a plan that's I'm going to pay $5,000. Guess what? There's probably a reason why you got a bill for $5,000. You had a stroke, or you got cancer, or you were diagnosed with wet macular degeneration, or needed needed infusion therapy. And so at that point, you're not going to be able to get a supplement back. And then there are higher copays for. Now listen, I want to address this because this is a big issue. There's a company that raised their maximum out of pocket to $7,500, a big jump. There's only 5 ways you can get there. Okay, I don't want people get this confused with the deductible. Right. You get cancer, need a lot of chemo or a lot of radiation or both. You end up in a skilled nursing facility for a period of 50, 60, 70 days. You do need some drugs infused or injected as an outpatient service for wet macular degeneration or infusion therapy. The last 2 are much more rare, that you needed a super high dollar wheelchair or you needed a prosthetic device. You needed an artificial limb. So that's the only way you can get there. You're not going to get there if you have 4, with the plans that we make sure our clients are on, because we make sure our clients aren't on plans that have, a per day hospital stay that can be in the thousands of dollars. We want them per stay of, between $275 and $350. So even if you had 4 hospitalizations and 3 surgeries, you're not going to get to that high dollar figure. Okay. But, and again, the biggest negative of Advantage plans, it's not that you might be billed $5,500 or $6,500 or $7,500 1 year. It's that you may never be able to get back to a supplement. That's the biggest risk. That, God forbid, you need Remicade therapy the rest of your life, and it's $400 every time you get it, and you go get it every 6 weeks. You are going to be in a situation where you're probably going to meet your out-of-pocket maximum every single year for the rest of your life, because you're not going to get back to a supplement.
It's about 5 minutes left in the hour. We have, I think, time to take one quick question here. Hi, you're on Medicare A to Z. We got about 3 minutes here. Who are we speaking with here?
Hi, you're speaking to Dawn. Can I have the number to the health store?
Yes, 724-603-3403. 724-603-3403.
Okay.
Thank you.
Your hours there, sir?
We're basically 8 to 8 now, Dawn. I mean, we're working crazy hours. So, I mean, we work by appointment at this time of year. The girls, you know, I've worked Saturday the last 3 weeks. I'm going to work Saturday again. All the admin staffs work Saturday and Sunday. So we'll get you in, my friend. Don't worry. You want to come? We'll be there.
Okay. Thank you very much. I appreciate your show. Thank you.
Thank you, Don. And in the last couple of minutes, I got to ask, one of the things they're always pitching is that if you sign up for an Advantage plan, you could get an extra $144.
No, it's not true. Okay, that's only for people who are very poor. Those are only for people who can get what's called extra help. In Pennsylvania, if you make, I think the cap of that is $1,500 a month, where the state will pay your Part B premium. Now there is a plan in Western Pennsylvania right now for people who have PACE and PACEnet, where they are given rebating some money back of that Part B, but not the full amount. It's 40. I think the highest one is a little over $50 or $60. So they will give you some of that back, but there is not a plan that's available that will refund you all your money. That is for people who are very low income. So don't fall for that. That bothers me a whole lot. That's a new pitch. They're just trying to get you on the phone with that. That's all they're trying to do. Get you on the phone, get somebody to fast talk you into a plan and sell you something that might not be best for you.
So, with our last couple of minutes here, what person should go for the Advantage?
Somebody who wants to, who's going to bet on their good health, Bill, and that can bet on, Mr. Williams, if you're listening. This guy's been with me for 12 years. He's one of my first clients I ever had. He's been as healthy as you could be. The only thing he's ever paid out of his pocket was a couple $100 for cataract surgery on both his eyes. He saved, for God's sakes, this guy saved $20,000, probably $15,000 to $18,000 in premiums that he would have spent on a supplement, and he would have never used his insurance. Okay, so but for every one of him, there's also somebody who maybe got cancer and needed chemo between October and March, and maybe they got billed $8,000 over the period of 6 months. So again, I suggest if you want to get an idea, you can call us. We can discuss whether you might be a candidate for a supplement or an Advantage plan. One thing I want to warn people is don't switch to an Advantage plan for the dental. Okay? A couple reasons. You're not going to go bankrupt because you don't have dental insurance that pays 50% for an $800 crown. Okay? Remember why we have insurance, people. We have insurance to protect our assets. That's why we have homeowners. That's why we have auto. That's why we have health insurance. Because if you lost your home, if you had a fire in your home and you couldn't pay back the mortgage, you could go bankrupt. If you didn't have health insurance, you could go bankrupt. If you didn't have auto insurance and you damaged somebody else's property, you might have to go bankrupt. You're not going to file bankruptcy because you got to pay for your own eyeglasses, and you're not going to go bankrupt because you didn't have an insurance company to pay for fillings. It would be like insuring your car. It's like insuring your car for tire changes and oil changes. We know that cars are something that's going to cost some money down the road somewhere. Same with your body. Okay? Same goes for there. So guys, listen, there's 21 days left of annual election. We're winding down the show here. 724-603-3403. GetYourBestPlan.com, and we'll be back the first Monday of December.
And this has been Medicare A to Z with Aaron Zolbrod of the Health Insurance Store on your local station, W266DB, WMBS, Uniontown.